Hi guys, it's your boy The Effulgence and welcome to my channel once again. And if you are new on this channel, please like, share and subscribe for more scholarly videos. So today we'll be looking at something very interesting, one of the pre-analytics of laboratory testing. And what could that be? We'll be looking at sample containers today. We'll be talking about the different sample containers we use for laboratory testing, their principles and mechanism of action, that's how they work, and tests these sample containers can be used for. Okay, now this class or this topic is actually directed to young medical laboratory science students, 200 level, 300 level. Okay, if you're a young medical laboratory science student or you started your posting and you've been seeing sample containers during your posting, it's not just enough as a medical laboratory science student to just know what sample containers are or being able to identify, okay, this is EDTA or this is lithium heparin. You should be able to also know how these sample containers work, their mechanism of action. Okay, how, for example, how EDTA anticoagulate blood, how it inhibits blood coagulation. You should be able to tell, and you should be able to also tell the different tests these sample containers can be used for. Okay, so that's what we're going to be discussing today. All right, so going very quickly, the first on my list is the EDTA container. Now, EDTA is an acronym, okay, and this is the container. Now, what's the meaning of EDTA? Okay, we have it could be dipotassium or tripotassium, but for this is a tripotassium EDTA, tripotassium ethylene diamine tetraacetic acid. I'll come again with that, ethylene diamine tetraacetic acid. That's the full meaning of EDTA. In case you could be asked in your Viva, 400 level first professional exam Viva, something like that. Okay, what's full meaning of EDTA? It's ethylene diamine tetraacetic acid. Now, how does EDTA inhibit blood coagulation? When we say coagulation, we mean how does it inhibit blood from clotting? Okay, now what this anticoagulant does, okay, is to inhibit or chelate calcium. Inhibit or chelate calcium. Now, calcium is factor 4. If we're looking at the coagulation cascade, calcium is actually factor 4, and calcium actually acts as a bridge between the platelets and other coagulation factors. Okay, so the chelation or inhibition of calcium will also inhibit blood coagulation. So that is how this sample container works, by chelating or inhibiting calcium. Okay, now this sample container called EDTA is mostly found most times in hematology laboratory. Okay, hematology laboratory. Now we use it most times, okay, for full blood count, example of tests for full blood count, peripheral blood film, PCV and other tests. Now, it's not only hematology lab, it's not only in hematology lab that we use this container. Okay, though I said it can usually found in the hematology laboratory, but it could also be used in the chemical pathology laboratory. Okay, you could be surprised, right? Maybe in chemical pathology laboratory, you may not have seen this container. Yes, it can be used in chemical pathology laboratory for glycated hemoglobin tests. Now, apart from the principle or mechanism of action of what I just said about this container, another thing this container does is to preserve the morphology of red blood cells. That's one good thing about this container. It preserves the morphology of red blood cells. So in chemical pathology, we use it, okay, for glycated hemoglobin. Take note of that. Then we also use it sometimes in medical microbiology. For example, if I want to do malaria parasite, definitely I will collect it into this. Now quickly, the sample container, okay, we're talking about is this lithium heparin. This container is majorly seen in the chemical pathology laboratory. chemical pathology laboratory. Okay, majorly seen in chemical pathology laboratory. Now, how does lithium heparin inhibit blood coagulation? That's the next question. Now, how this inhibit blood coagulation is by activating what we call antithrombin 3. It will activate antithrombin 3. Antithrombin 3 will then inhibit thrombin. Now, when thrombin is inhibited, definitely the conversion of fibrinogen to fibrin will also be inhibited, thereby inhibiting blood coagulation. That is how this container works. Lithium heparin, it activates antithrombin 3, which will then inhibit thrombin, thereby inhibiting also the conversion of fibrinogen to fibrin. So in summary, that is how lithium heparin inhibits the coagulation process or inhibits blood from coagulating. Now, like I said earlier, we could see this a lot in the chemical pathology laboratory, and it could be used for various assays, for various analysis and various tests. Okay, for example, we could use this for EUCR, electrolyte urea and creatinine. We could use this for serum bilirubin, definitely, which is not sometimes or most times under LFT. We could use this for CSF protein and other tests we do in chemical pathology. Then this container, you must have seen it. This is the plain container. We can see this container in the chemical pathology laboratory. You can also see it in the hematology and blood bank. You can also see it in medical microbiology. Now, most of the assays we use lithium heparin for, we also use plain container for it. I'm talking about in chemical pathology now. In fact, in chemical pathology, most of the times we prefer serum to plasma, and that even brings me to the question: what's the difference between serum and plasma? Now, for the sake of young medical laboratory science students, okay, you could be asked this question: what is the difference between serum and plasma? Now, apart from the fact that plasma could be gotten from anticoagulated blood and serum could be gotten from coagulated blood after being coagulated and spun, another major difference is that in all these containers that contains anticoagulants, okay, fibrinogen is present in plasma. Fibrinogen is absent in serum. Here, fibrinogen has been converted to fibrin after blood coagulation. But here, the inhibition of whatever the anticoagulant has inhibited, okay, we prevent fibrinogen from converting to fibrin. Okay, so that's another major difference. So if they ask you, okay, what's the difference between serum and plasma, we tell them, okay, fibrinogen is present in plasma, while fibrinogen is absent in serum. Okay, so like I said, the chemical pathology, most of the assays we use this for, we can also use plain containers, and in chemical pathology we even prefer serum most times to plasma, except maybe in cases like maybe liver function test, whereby fibrinogen here could cause maybe a little false increase in total proteins. So we prefer this. Okay, we prefer this, and we can also use this for electrolytes, because some research have said that during blood coagulation if the patient is having, for example, increased platelet counts, and we are having potassium in platelets, so if the patient is having increased platelet counts during blood coagulation, the potassium would actually escape into serum, causing false increase in potassium. So most times we use lithium heparin for EUC, okay, especially electrolytes. Okay, now leaving chemistry, for hematology we use this for serological tests, serological assays. we use this for blood group. I know a lot of labs will use this. This can also work, but here I am now, the institution I am now, we use plain containers for serological assays. Even in medical microbiology, if we are doing serological assays, be it wide aspergillus test, VDROL and others, we use serum. Okay, now the next sample container I'm going to be talking about is this. Now this is a very popular container in laboratory testing, and we majorly see this in the chemical pathology lab. It is called the sodium fluoride container. That's the short name for it. The full name is I made a mistake. The name of this container is fluoride oxalate container. Fluoride oxalate container. Okay, now the full name is sodium fluoride potassium oxalate container, and we use it most times for glucose estimation, be it plasma glucose, fasting random, CSF glucose, or any other aspirate glucose. But majorly, whether OGTT, 2 hours postprandial, we use this usually for glucose estimation. Now, like I said earlier, in this bottle, how does this bottle work, and why do we even use it for glucose estimation? How does it work? Why can't I use lithium heparin for glucose estimation? Why do I use this? Because this bottle contains two major things, two major agents. Okay, like I said earlier, sodium fluoride and potassium oxalate. Now, the potassium oxalate is the anticoagulant that prevents blood coagulation, while sodium fluoride is an anti-glycolytic agent that prevents glycolysis from occurring. Okay, now if you can remember very well, if we go back to our 200 level, we look at the glycolytic pathway. If you can remember, I think there are 10 steps there. The conversion of glucose to glucose 6-phosphate, glucose 6-phosphate to fructose 6-phosphate, fructose 6-phosphate to fructose 1,6-diphosphate, from there to glyceraldehyde 3-phosphate, glyceraldehyde 3-phosphate to 1,3-diphosphoglycerate, then to 3-phosphoglycerate to 2-phosphoglycerate, then to phosphoenolpyruvate and pyruvate. Now, if we look at the 9th step of glycolysis, there is an enzyme there. During the conversion of 3-phosphoglycerate to phosphoenol, from 3-phosphoglycerate, from 2-phosphoglycerate to phosphoenolpyruvate, okay, there is an enzyme there known as enolis. Okay, now sodium fluoride will inhibit that enzyme called enolis. Now, immediately that enzyme is inhibited, glycolysis is inhibited. That's the full breakdown of red cells, okay, is inhibited. So, like I said earlier, this sample container can be used for glucose estimation. I have just explained how the anticoagulant and the anti-glycolytic agent in this container work and why we use it for glucose estimation. Now, this is also lithium heparin container, but I will be using it in talking about sodium citrate container because the color looks like this, but this right now is also lithium heparin container, but I'll be using it to explain sodium citrate container. Now, sodium citrate container, we use it most of the times in hematology laboratory for coagulation testing, for coagulation assays. When I say coagulation assays, I mean prothrombin time, APTT, activated tromboplastin time. Okay, this is what we use. Now, this also binds. How does this work? It binds with calcium. The anticoagulant here binds with calcium, thereby preventing calcium from forming a complex with factor 7, which is also known as proconvertin or Leber factor. Now, this anticoagulant sodium citrate also inhibits factor 10. Factor 10 which is the Stewart-Proud factor. Now, the inhibition of all these factors prevents blood coagulation. Okay, then this is another sample container called the sterile universal container. It's called sterile for it should be sterile because we mostly see this in medical microbiology laboratory. And in medical microbiology laboratory, sterility is key. Sterility is very, very key in order to prevent contamination and all the rest. So this container must be sterile, and it doesn't contain any preservatives or anticoagulants. So these two containers having red tops, this is the plain container and this is the sterile universal container, they contain no addictive or preservatives or anticoagulants. Okay, so this does not contain anything, and like I said, we use it most times in medical microbiology lab. Okay, for example, urine MCS, we use it in collecting urine for urine MCS. We use it in collecting stool for stool MCS. We use it in collecting aspirates such as cerebrospinal fluid for MCS and other sterile fluids like peritoneal fluid, pleural fluid. For microscopic culture and sensitivity, we use this. Okay, that's why it's called sterile universal container. Okay, now apart from medical microbiology, we can also use this in chemical pathology lab. Okay, for example, if I want to do 24 hours urine, it should come in this 24 hours urine protein estimation, it should come in this. If I want to do albumin creatinine ratio, the urine should come in this. If I'm to do fecal occult blood, the stool should come in this. So we also use it in chemical pathology laboratory. Now, all these sample containers I just spoke about, this sample container, they also have what we call vacutainers. Okay, I couldn't lay my hands on any of them, but maybe I would put up some image of some on my screen, okay, for you to see. Now, these containers also have what we call vacutainers. Now, the vacutainers also work with the same principle I just explained. Okay, I just explained with these sample containers. Okay, so if for example you see the vacutainer of EDTA, most times they have this lavender color, or what we call this purple coloration. It's a longer tube. Okay, it has a purple coloration, but it works, the mechanism of action is same with this, the same with every other sample container I've spoken about. Hope I've been able to pass a very good message, and I hope you understand how most of the sample containers work, we use for laboratory testing work. Okay, so please do not forget to like, share and subscribe for more scholarly videos. Thank you very much.